Welcome back to MedTube, the only news broadcast run by almost doctors for patients. I'm your host, Sally Smartpants, and today we'll be focusing on conditions affecting the largest organ of the body, the skin. The main topic of today's discussion will be something on a word that, like many medical words, sounds like something out of a Harry Potter book, and that word is psoriasis.
Psoriasis.
Joining us today to explain this condition are two dermatology experts from the National Psoriasis Foundation, Dr. T and Dr. Cortisone.
Thanks for having us.
Happy to be here.
Accompanying them is our local celebrity who, like many others, has been impacted by this condition. Ladies and gentlemen, the one and only reality TV's Jendal Kenner.
Welcome everyone. Thank you for being here.
So I suppose the first thing our 50 subscribers back home and the audience members here would like to know is a fairly obvious question. What is psoriasis?
I mean, definitely, that is a good question. So, psoriasis is a chronic, which means long-lasting condition that affects the skin, and it's caused by the dysfunction of the body's immune system. The immune system is the system that fights off infections. This leads to inflammation. So eventually there's a buildup of skin which forms the characteristic well-defined scaly rough red patches called plaques of psoriasis. It is important to note that this is not contagious.
Now for the people such as myself who don't really understand how the immune system and the skin interact with one another, could you perhaps shed some light on that situation?
So as Dr. T mentioned, some people develop psoriasis when their immune system becomes overactive, and the immune cells produce chemicals that cause the skin cells to grow faster than normal. Normal skin cells completely grow and shed, or rather fall off, within a month. In psoriasis, the skin cells are overachievers. They do a month's worth of growth in just 1 week. It's just different in that these skin cells don't fall off like they normally would, leading to them building up on the surface and the skin forming plaques.
You guys have mentioned the plaques of psoriasis a lot, but I'm guessing not many people out there have actually seen it. Would you care to provide a visual demonstration for our audience?
Sure thing, I'll put an image up on the screen here. So as I mentioned before, these lesions are usually pink or red. They're well defined and rough. These are called plaques, and they usually have a silvery scale to them. They can affect any part of your body, but they usually occur on the knees, the shins, the elbows, the scalp, and the lower back. Less commonly, they may affect your palms or soles.
Thank you for that, Dr. T. I've just received intel that our viewers have been posting questions to our Twitter page. I definitely don't have psoriasis 3375 has asked, what are the symptoms of Poseidon, which I'm guessing should read psoriasis.
That's something I think I can actually answer, docs, if that's fine. So when I first got psoriasis, right, my skin was like itching and very dry and cracked and burning, very itchy. And then when I was scratching it, like the plaques would be bleeding, and then that was very disturbing. So I went to my doctor, I was diagnosed with psoriasis, and then she also told me that some people get like arthritis, I think it's called, which is like sore, aching joints, but I don't have that because I'm lucky, so.
So that's exactly correct, Ms. Kenner. Thank you for sharing that. So if I may add, there may also be some changes to your nails. For example, you can have pitting with your fingernails or toenails. There can be separation of the nail plate from the nail bed. You can have spots of yellow discoloration involving the nail bed. There can also be thickening of the skin between the nail plate and the nail bed.
I mean, so Doc, I wanted to ask actually, like I'm just trying to wrap my head around it. Who gets psoriasis? Like, why did I get it? Like, why me? You know?
There are multiple factors that put people at risk for psoriasis. This includes genetic factors, so having other family members with psoriasis. So interestingly, actually, Kim Kardashian and her mother Kris Jenner have psoriasis.
You mean I have the same skin condition as an A-list celebrity? That means I'm a beast diva.
So I don't know much about those lists, but I know that I wasn't done with mine.
Please continue.
Thank you. So other risk factors for psoriasis include having other diseases related to the immune system, like Crohn's disease, which is a type of inflammation of the gut, and multiple sclerosis, which affects the nerves. Psoriasis is more common in Caucasians, but it can happen to anyone.
Yo. I'm going to get psoriasis. Foei toch, man.
I apologize. It appears we're having some interference. Our sports reporter appears to have turned his mic on. But Would you like to join in on the discussion?
Nee man, jammer om te interject, Sally. It's a biggie stressed. Me and Amanda, we play a lot of sport, spend a lot of time in the sun. So I just wanted to find out, is this something that can wake up my psoriasis, man?
I mean, you're on a track, and I hope I'm following it. I think that what you may be asking is, are there things that may trigger psoriasis in someone who already has it?
Yeah, Doc, that's what I meant.
Alright, well, the symptoms of psoriasis tend to come and go. At times they may get worse, which is called a flare, and there can be certain triggers that causes flares for certain people, but it differs amongst different people. But it is important to know what makes your psoriasis worse so that you can avoid the triggers.
Perhaps, Miss Kenner, you know a lot and everything, right? Yeah, so maybe you can tell us what some of your triggers are.
Well, yeah, like for me, right, physical stress and also like mental stress makes my psoriasis worse, like it flares up, and also cold weather. But for some other people, like not me, I don't smoke and drink, but other people do, and it can make their psoriasis worse as well. If you get like a skin infection, or like an ear infection, that can also make your psoriasis worse. My aunt actually, she also has psoriasis, right? And she has a food allergy, and when she eats the food, then her psoriasis flares up. And then my cousin, John, he also has psoriasis, and then when he takes certain medications, then that can also make his psoriasis worse. Like he took this one medication, corticosteroids, yeah, and then he stopped it suddenly, and then his psoriasis like got really bad. So I guess we all just felt differently, you know.
So if people are built differently and they have different triggers, does this mean there's different types of psoriasis?
So yes, but you're exactly correct. The most common form of psoriasis is plaque psoriasis.
That's the one that I have. Yeah.
Yeah. So there are actually 5 types of psoriasis. So we've already mentioned one of the 5 psoriasis, which is plaque psoriasis, and this is the commonest form. The second form of psoriasis is guttate psoriasis, otherwise known as raindrop psoriasis because of the way the lesions look. This usually affects children after having a flu-like infection, and it may occur once and never again. The third type of psoriasis is inverse psoriasis, because this affects the opposite sides of plaque psoriasis. So the inside of the elbows, the back of the knees, the body folds such as the armpits and under the breast. It is triggered by friction and sweating. The fourth type of psoriasis is pustular psoriasis. This contains pimples filled with pus. This type of psoriasis can occur over and over again and may be associated with fever, but like all other types of psoriasis, is not contagious. Lastly, the fifth type of psoriasis is erythrodermal psoriasis. This is a full body psoriasis where the skin resembles a burn. This is the most dangerous type as it can be complicated by infection and dehydration.
Thank you, doctors and Miss Kenner. The next tweet is from @Ryan Reynolds Wifey, and she wants to know, how do you treat psoriasis, which again I'm assuming should be psoriasis?
When treating psoriasis, we work in 3 stages. Firstly, treating the condition at the site, so on the skin, which is called topical treatment. If this does not work, we add light therapy or medication that targets the immune system directly. Most types of treatment of psoriasis work by reducing inflammation or by slowing down skin cell growth. We have quite a few things that we can use to treat the skin directly, and this includes topical steroids. So normally one would use these daily if you're having a flare-up, and then you use them less frequently when you're in remission, when the flare-ups finish. But you always use the medication as your doctor has told you to. We also use vitamin D analogs, and these are medications that are similar to vitamin D. We also use topical tar, which slows down the cell growth and removes scales. But our main descaler is salicylic acid, so it removes the scale to allow exposure of underlying skin to other medications, which allows for better absorption of other medications through the scalp. So if this doesn't work by itself, we add light therapy or phototherapy in the form of natural sunlight or UV radiation. And this is usually used for people with moderate to severe psoriasis. Systemic treatment, so in other words, medicines that you take by the mouth, are only really used when topical and phototherapy fails. And these medications suppress your body's entire immune system, but they are effective, however they have many side effects. So Dr. T will take you through those because that was a mouthful.
Yeah, exactly. So I'll just talk about some of the side effects of the medication. So please be aware that you need to go to your doctor if you experience any of the following after taking your psoriasis medication. This includes hives, difficulty breathing, feeling lightheaded, swelling of your face, lips, tongue, or throat.
Some of the other side effects of common medications used to treat psoriasis are shown on the screen. Please note that not everyone will experience all of these side effects, but if you do, you need to inform your doctor immediately.
Speaking of burning, I have a burning question. Can psoriasis be cured?
Yeah, so thanks for that question. So psoriasis is a lifelong condition and there is no definite cure available yet. The goal of the treatment is to best control your symptoms, it has to be convenient for you, and it has to be affordable.
Wait, Doc, so does this mean that I have to go to my doctor like every week for my psoriasis checkups?
So, because you were diagnosed quite recently, you'll probably see your doctor more frequently while you're trying out the different treatment options and trying to figure out what works best for you. But once you've found a treatment that controls your symptoms well, you should be visiting your doctor less frequently, but regular checkups are still very important. So usually these will be between every 3 to 6 months, just to make sure that your psoriasis is well under control and that you're not having any new concerning symptoms. But there are some symptoms that if you get, you should go to your doctor immediately, but I'm sure your doctor will do that with you.
Yeah. I mean, she basically said that like I should go back if my skin gets more sore, or like if I develop any joint pain, or like if I had joint pain it gets more sore. If my nails start looking different. She said that if I get like a skin infection, which would be like it would be like red and sore, and I might like have a fever or something, then I should go back to her as well. And she also said that if I develop any new like health symptoms, like maybe dizziness, or like my heart starts racing, or just unexplained weight gain, then that could be like diabetes or heart problems, she said. And then I should go back to her because I am at high risk of those things by having psoriasis. So,
Sally, I just received a tweet, and it's from the Real Terminova 178. It says, what can happen if psychiatry isn't treated properly? I'm seeing the trend about the spelling here.
That is a good question and an important one, because sometimes we do struggle to get our patients under control, and this can lead to complications such as increased risk of developing heart disease, blood vessel disease, and diabetes, high blood pressure, and also kidney disease. It also increases the risk of having other autoimmune diseases and developing eye problems. And of course, there is quite a strong push now about recognizing depression and the mental health issues that surround psoriasis. But luckily, these things are not very common because we try our very best to keep our patients well controlled. Some patients may even go months without symptoms between flare-ups, but this only works if the patient takes their medication as directed by their doctor.
So I think what we have learned today is that psoriasis is a very manageable condition, but it's important to take your treatment seriously in order to avoid the complications that our doctors mentioned today. And to keep an eye on whether your symptoms are evolving or if you are having any side effects to those medications. Thank you, Dr. T, Dr. Cortisone, and Ms. Kenner for your valuable inputs today. Any final comments?
Thanks for having us.
thank you. And I just wanted to say to all those out there listening with psoriasis that I know it can be a super frustrating condition and it can make you feel super insecure about yourself. But I've found that sharing my experience with people who can relate to it is very uplifting. And having a great team of doctors around me makes managing my health so much easier. So just know that you're not alone and that there are friends at the National Psoriasis Foundation that you can always reach out to if you have any more questions or need more information.
Wow, powerful words, Ms. Kenner. Thank you for that. Well, folks, that's the end of this week's MedTube production. See you next week for our segment on medical school conspiracy theories. Don't miss out on our debate on whether med school is actually run by robots or aliens. Over to Boot with the weather forecast.
Okay, thank you, Sally. So Cape Town tomorrow, split winds every day. In the morning, it will be summer. Midday, winter. Afternoon, autumn. Evening, spring. Thank you, Nana.